Pelvic ultrasound of demoid cyst. An ovarian demoid cyst, also called mature cystic teratoma, is a fluid-filled sac containing tissues from your hair, skin, teeth, or other body parts. They are mostly asymptomatic but may cause pain when they grow big. The clinical presentation includes pelvic pain, painful intercourse, and when they are very huge, it can be palpable. It has the following complications: rupture. An ovarian cyst can rupture and fluid will leak into the peritoneal cavity. Often the fluid can be seen in the Morrison pouch, splenorenal recess, and both paracolic gutters. Another complication is ovarian torsion. Demoid cyst can cause ovarian torsion when it grows very big. This can cause the ovary to twist along its supporting tissues, leading to vascular compromise. We are going to discuss the various characteristics of demoid cyst on ultrasound. The image on the right part of the screen is a demoid cyst. We are going to talk about demoid plug, demoid mesh, tip of the iceberg sign, and fat fluid level. These are the characteristics of a demoid cyst on ultrasound. A demoid plug is the first one. It is the most common sonography feature of a demoid cyst. The arrow is pointing at the demoid plug, which appears as an echogenic mass within the cyst that is made up of hair, teeth, or fat, and you can see the posterior acoustic shadows behind the demoid plug. The second is the demoid mesh. They appear as multiple small hyperechoic lines and dots within the cyst, forming a mesh-like picture. These echogenic foci are small hairs floating in the cystic fluid. The arrow is pointing at the hyperechoic dots and lines. The image here is showing both the demoid plug casting posterior acoustic shadow and the multiple hyperechoic lines known as the demoid mesh. You can appreciate the hair as seen as the echogenic stripes. Then the tip of the iceberg sign. This appears as a hyperechoic area in which the base cannot be fully visualized. You can see the tip of the iceberg, a huge mass, echogenic mass, casting serious acoustic shadow. Fat fluid level, which is the last characteristics. It is also known as hair fluid level. Here you can see a well-defined unilocular cystic mass having both hyperechoic and hypoechoic layers. The hyperechoic layer is seen floating on the hypoechoic layer. This is characteristic that is typical of a demoid cyst. We will now look at videos demonstrating demoid cysts. This right ovary harbors a well-defined unilocular heterogeneous cystic mass with multiple hyperechoic lines, which we can see, and dots, giving the characteristics of a demoid mesh, and a hyperechoic fat component, casting posterior acoustic shadows. You can appreciate the demoid cyst with multiple hyperechoic lines and dots within the cystic mass, and a demoid plug casting posterior acoustic shadow. Okay, this is another cyst, a well-defined unilocular cystic mass with a fat component casting posterior acoustic shadow. This is another mass, a well-circumscribed unilocular cystic mass with hyperechogenic demoid plug casting posterior acoustic shadows. Thank you so much for watching. Please subscribe to our channel to support what we are doing.